Codeine, Vicodin, morphine, and fentanyl are among the strongest drugs fueling the opioid epidemic in America. They produce a euphoric feeling that can be addictive.
So how do we combat a crisis in pain medication when the solution of withdrawal is so painful? Alice Benjamin is an emergency room RN and clinical nurse specialist. Welcome back. Good to see you.
Thank you.
Morning. So what is the current approach of addiction and withdrawal for opioid use?
Well, addiction is a very complex process. It really requires a comprehensive approach to getting someone to get off of drugs and then to maintain their sobriety. There needs to be not only medication for the addiction, but therapy and counseling. There's other medical services. There's also educational and vocational training that needs to happen. There's a social support and network that needs to be ensured. So it's really a multifaceted approach, and it can be overwhelming for people who find themselves in it.
And as an emergency nurse, you see patients who have abused pain meds. What are some of the symptoms and stages of an opioid withdrawal?
It's very tragic when I see this, and unfortunately I see it more often than I want to. So I see people who've been rescued by EMS with Narcan, and they come in and they immediately are in the withdrawal process because of the Narcan use. And so it's actually kind of violent nausea and vomiting and diarrhea, massive fluid losses. They're losing electrolytes. They're having tremendous pain, irritability, tachycardia, anxiety. So it's very uncomfortable for them. It can actually be very violent, where they need medical supervision, and we often admit these people for continued monitoring and services, because to go through withdrawal alone, unattended, without assistance, is nearly impossible.
Really?
Wow. A new ear device called the Bridge is being promoted as a non-medication solution. Tell us about that.
So I'm actually excited to see this. We're actually expanding the approach when it comes to treatment, when it comes to addiction. This is a microchip that sits in a plastic case discreetly behind your ear. There are electrodes sitting outside and around your ear that send gentle electrical impulses to nerve endings, which tell our brain to reset itself so it's no longer sensing traditional pain. So what happens when you're on chronic opioid use is, for lack of better words, it fries the nerve endings, the nerve pathways. So what may look like something that should cause this much pain, someone who's in opioid addiction has this much pain. So this device can sit on your ear, and manufacturers say it can be effective as soon as 10 minutes after application. Wow. And can really play an important role in the addiction therapy.
And there's also a new addiction medication out called Vivitrol. What are the pros and cons of that?
So Vivitrol also has its place in addiction therapy. Now, it's different from the traditional mainstay therapies in that it actually blocks the receptors from opioids. So once someone is on Vivitrol, it's a once-a-month injection, and it's not an opioid, so there's no worry about addiction. And what it does is it blocks the euphoria from the opioids.
Wow.
Oh, wow, that's interesting.
Yes, so it's very safe, it's very simple to give, but there's a time and place for it, because if you give it too soon, it can actually precipitate someone's withdrawal. So Vivitrol is only used after someone's gone through the withdrawal phase, and there are different phases. So someone needs to be off of opioids for at least 7 to 10 days before they use Vivitrol.
So we've all heard about methadone, or most of us have, and then what about this other thing called Suboxone?
Yes, so methadone and Suboxone have been the mainstay. There's lots of research and evidence that shows they're effective in helping people through the addiction recovery process. Now the thing is, they're opioids. So, but they're a little bit different in the sense that they don't provide that same euphoria. However, they still do carry the risk of respiratory depression, cardiac depression. So it needs to be administered in a very supervised setting. So because of that supervised setting, it can sometimes limit access, because you have to have access to a particular provider. Not any physician can prescribe this. So it limits access, it limits the timeliness of receiving these things, but they're very helpful. So, and with methadone and Suboxone, you can actually give those right away. You can plan, say, hey, you know what, I want to get off of prescription drugs, I need help, and you can begin your methadone right away, where in comparison to Vivitrol, you have to wait till you've gone through the detox process before you can use that medication.
Is there a place people can go, a website or something that lays out how each of these drugs should be used and how you can treat opioid addiction?
Absolutely, and I want to encourage people to do this. You can go to fda.org/MedWatch, and there's information there. You can put in, the names of these medications, the names of this new therapies to find out what's going on, what's FDA approved, what's safe, and actually if you're on these medications, you can actually report how you're feeling so we can gather that evidence. And the more information we have, the more we can look at these other devices to see if is it effective and really push those that are working to the main front.
All right. Well, for more information about clinical nurse specialist Alice Benjamin, follow her on social media and check out our website, asknursealice.com. Thanks for coming in.
Thank you.
Thank you. Thank you.
Okay.